There are pertinent issues we wish to discuss today, and I would like to welcome the panelists to take up their seats, and we can start our discussion. The media in the room, you're welcome. Those who are joining online, you're welcome. We are going to be sharing a YouTube link shortly, such that you can watch wherever you are, because this is streamed live. We've had several discussions. This is our third edition of these discussions. They are also referred to as webinars. We had earlier a discussion on community prescriptions and self-medication. We had a team that shared with us. Last weekend, we were discussing vaccines, COVID-19 vaccines. And today, we have a topic that is dear to us, that cuts across, which is psychological support, mental health, and home-based care. I know very many people are going through hard times due to the measures government has instituted to curb the transmission of COVID-19. So we have a team of experts who will help us answer to our questions and also help us understand how we can live during these times of the COVID-19 pandemic. So allow me welcome Violet Alinda, the country lead of Twaweza, to give her opening remarks. Is Violet ready?
I'm sorry that I'm unable to turn on my camera because my internet is very poor, but I hope I can do this very quickly, and then we will move on to the session. You're almost welcome to this session, and like our moderator has already explained, we really want to use this as a platform where we can share and provide information to the participants, but also who in turn, our anticipation is that they will also share the same information more broadly, so that as we continue to be at home and try to figure out how to live and survive the tough times, we basically have some information that helps us to cope with the situations that we are in. We know that all our children are at home, but we also know the financial stress that comes with people being in homes. And we also know the uncertainties and what that creates for our well-being. So this morning, we are being joined by a panelist of experts that are going to be discussing a number of issues from a perspective of providing us information so that we are better equipped to deal with the uncertainties, to cope with the challenges. And of course, as an organization, we are really glad that the Ministry of Health has really worked with us this journey. Now in the third series, we still have other editions to come. And we are also glad that the members of the media, the journalists, continue to be a part of this process and continue to pick this information and spread it across the country. And of course, from our perspective, we think in times like this, information continues to play a key role in our midst so that whatever actions we take individually or as a collective, they are informed. But most importantly for today, our mental wealth, we are able to pick the pieces and continue to live a normal life. You're all most welcome. I do not know whether my colleagues from Dar es Salaam have joined, but of course, if they have not, they are welcome. Whenever they join us, they should know that we recognize their presence, and our colleagues from the Kenya office will recognize their presence. And of course, also our colleagues from the Ugandan team that and the moderator to run us through the presentations for the day. Over to you, Mr. Ineviona. Thank you.
Thank you very much for those brief remarks, and we welcome once again our audiences that are joining us via Zoom and yes, we welcome all our audiences joining us via Zoom, via YouTube, and also subsequently we'll have questions from people who are joining on Zoom. I would be glad to introduce some of them once the technical team shares. So I'm glad to host the following panelists. We have Marie Nanyanzi, who is the Senior Program Officer at Twaweza. We have Dr. Hafsa Rukwata, who is an Assistant Commissioner in the Ministry of Health and is in charge of mental health and also substance abuse. We have Elizabeth Ocaro, President, Uganda Counselling Association. We also have Professor Winston Muhwezi, Associate Professor, Behavioral Sciences at Makerere University. We also have Dr. Jane Irene Nabakoza, who we hope should be joining us via Zoom. We have Vincent Mujune, I hope I got it right, who is the Communications, Partnerships and Advocacy Manager at Strong Minds. These are our panelists today, and I will give them an opportunity to give brief remarks within like 5 minutes each to give us brief remarks about these topics, and also welcome remarks to highlight where they come from, some brief about their entities. But I will begin with Marie Nanyanzi to give us highlights. Marie, you're welcome.
My name is Marie Nanyanzi, and I'm from Twaweza, East Africa. I sit here in Uganda. I'm the Senior Program Officer for Sauti za Wananchi. By sharing my screen. The host, please allow me to share my screen. Okay. Okay, good morning, everyone. Once again, thank you for taking the time. Host, please make me, remove me from co-host so that we don't have to hear the noise as people get in. Okay, I hope I'm audible now. So today I will be sharing some of the findings that we have collected in our Sauti za Wananchi program in Uganda, both from the national panel that is nationally representative across the 15 sub-regions of Uganda, and also some findings from the residents of Kampala, which data was collected the last week of June. Okay, so briefly about our methodology, I've mentioned we have two panels, the national panel, which goes to the 15 sub-regions of Uganda, and then we have the panel that is limited to Kampala district. So from this panel, we speak to about 750 respondents across the different divisions of Kampala. And those are some of the findings that we'll be showing here on what citizens are experiencing. And these could be triggers of stress, but we expect that the experts on the panel will be able to guide us more on how the people in Uganda can deal with these challenges. So briefly, we collect our data using a mobile data collection platform, which we call the computer-aided telephonic interviews. We script the tool and then have that given to our enumerators that sit at our call center, although now they are all working from home. And then they administer that interview in different languages. So we are able to have the translated tools as they do this, so that we are able to have that rapport with the respondent, so that you don't have to force Marie to speak English when she prefers to speak Luganda or another language. Then once the data has been collected, we have our reports, and then we are able to launch them in forums such as this, and also in targeted spaces, which are usually closed. And maybe to emphasize that the data that we produce through the Sauti za Wananchi program is always available on our website. You can always go there and use that information. All we require from you is to acknowledge that this was gotten from Taweza's Sauti za Wananchi program. And the reason we do this is because we know that it's important for our policymakers to formulate policies that are informed by the citizens' experiences. So for our findings today, I'll start by talking about what we discovered in Kampala, that is in June. We asked a question, what percentage of people are worried about the spread of COVID-19 in Uganda? And we did see that 95% were worried about this. And what was their main cause of why are they worried? 53% say that people are dying at a high rate. That is why they are really worried. And then 20% say that there are many patients suffering from COVID-19. Then 17% say that they have the loss of income worries them. Then 13% worry about the rapid spread of the COVID-19 virus. And then 11% worry about the lockdown. Then we also do see that when we asked who feels that they're at risk of contracting the virus, 42% said that they're worried that they will contract, they're worried about contracting this virus. And take note that this is a question that we have asked during the lockdown. So even with all the measures that are in place, 42% are still worried that they might contract the virus. We asked the same question last year in July, and this percentage was slightly lower at 40%. And by that time, we're out of the lockdown, which was maybe more understandable, for lack of a better word. But what was really triggering the worry at that point in time is that people were interacting with many people. That is why they were worried that they would contract the coronavirus. Now, what we see here is that the key concerns are the high rate of death, the number of patients that are getting sick, the loss of income, the rapid spread, and then the lockdown measures. Then we also try to understand how, in terms of treatment, in case someone got sick, because we have seen that a number of people are worried that they will contract the coronavirus. So in case they contract the coronavirus, are they confident that they will quickly get treated? We see that only 36% are confident that they will quickly get treated. And those that are confident, 18% say that the health facilities are available, 6% say that the treatment is available, and 6% say that the medication is available. Then for those that are not confident that they'll be treated quickly, that they'll get the treatment, 26% point to the fact that they feel that the treatment is expensive for COVID-19 in Uganda. And then 14% say that there is a shortage of facilities to go to get treatment. Then 10% say that the hospitals are full. Now, these are the people in Kampala saying this. Then 9% say that no transport for the patients. In case you get sick, how will you get to the hospital? Then 7% point to the poor health system. Then 5% mention that there is no cure for COVID, and 5% say that they lack the resources to actually ensure that they get the treatment. So we again continue to ask, what do they feel about the confidence of the government? What confidence do they have in the government in handling the current COVID-19 crisis? And we see that 19% say that they're very confident, while 32% say that they're not confident that the government can handle the current crisis, which could also be another trigger for stress. We see that 49% are in the middle. They really don't know much about what they can say on that. So overall, we see that the low confidence in receiving care and treatment, if one became ill, would be a major source of stress for the residents of Kampala. So we also try to ask, we asked another question about adherence to the SOPs, and they mentioned some of them. But in asking what is it that motivates them to adhere to these SOPs, we see that 51% mentioned that they want to prevent themselves from contracting the COVID-19 virus, and then 30%, the fear of death is what motivates them to follow the SOPs. Then 13% talk about not spreading the virus. Then 4% say that they have been sensitized. That's why they are following the SOPs. Then 2% talk about security enforcement as being something that motivates them to follow the SOPs. Then 1% say that the treatment is expensive. So overall, we see that the personal concerns are what dominates the motivation to adhere to the SOPs, which in a way you could say would sort of imply that they know that they have to, it's a personal initiative to really stay safe and stop yourself from contracting the COVID-19 virus, and also not end up in a hospital. In November last year, we conducted another survey, which is nationwide, that is from our Sauti Za Wananchi national panel. And here we did also try to understand in the communities where our respondents reside, what do they think about the following things? Have they become worse or better during the coronavirus pandemic? And we included this question after seeing a lot of media reports about violence in homes and also in communities. What we did see from this data is that citizens say that violence, teenage pregnancy, and other social problems have increased in their community during the pandemic, where we see that 51% say that physical violence got worse. Then 51% say that emotional violence got worse. That is the insults, the threats that they are receiving got worse within their community. Then 46% mentioned that sexual violence or assault had actually gotten worse in their community. We still have a few, we did see a few that were saying that it actually got better, but this was still about 2 out of 10 that say that it got better. But for the larger part of it, a half of our citizens in Uganda were saying that this got worse. Then when it came to the teenage pregnancy, 79% mentioned that within their community, they feel that the issue of teenage pregnancy got worse. Then when it comes to the alcohol consumption, 58% say that this got worse. And also when it comes to the drug use and abuse, 49% say that this situation got worse within their community. And overall, looking at all these situations that we asked them about, we did take note that women and residents of the urban areas are more likely to say that violence has gotten worse in their community. Then when we look at in the past month, still again, among the citizens of Uganda, this was also from our national survey, we asked in terms of understanding the issue of food security, in the past month, how many times did they lack something or food because they didn't have resources or money? This question we asked in the month of May, that is when we were in the first lockdown last year. And we did see that overall, 7 out of 10 citizens worried about running out of food during the lockdown. And then we see that about 35% said that they ate less than they thought they should. And this is something that they experienced 5 times, or they had to skip a meal because they didn't have resources during the lockdown. Then 18% say that they were worried that their household would run out of food. Then 18% again say that they went hungry but did not eat because they did not have food or money to ensure that they had a meal. And about 9% say that they went a whole day without having a meal. And this is something that they experienced 5 times or more in a week, meaning that this is something that happened at least half of a week that they did go through that. And now that we are going through a lockdown, the question is, isn't that still a similar challenge for some of the citizens of Uganda? And how do we help them to cope with such situations? Then again, we asked a question. Now this was from the residents of Kampala. How long would the food that they have available in their household last before running out? We had asked this question in July last year, and also asked this in June. In July last year, as we're getting out of the lockdown, we did see that 13% said that they had no food stored in their home. In other words, they had nothing already, so they were not worried about running out of food. They already had nothing. In June, that is the last week of June, or the last 10 days of June, we did see that 38% mentioned that they had no food at their household, meaning they have to go out and look for that food. And that is during this current lockdown. So we see that the issue of food security continues to be a problem for Ugandans. That is from the very start of the pandemic in Uganda and till the present day when we are going through this lockdown. And that again could be a trigger of stress for the residents of Kampala. So to conclude, we have seen that Ugandans are faced with different challenges since the onset of the pandemic. And we feel that there is a need for the experts, the duty bearers, to really give more or sensitize us more about the mental well-being and how we can cope. Because to some extent, you could think that maybe in our community, it's not allowed to show weakness, that you're struggling mentally, that you're supposed to just brave it and go through it. But we need to get guidance on how does one cope with this. Is it okay to actually talk about it? Then also we feel that there is a need to explore opportunities for platforms that can reach many in addressing the mental well-being, because you could find that maybe for those that are able to access online platforms, or they've learned about this in school, then they are able to cope with that. But how about that person that has not attained that high level of education? How do we get to them in a language that they understand? And are these services available for them? Are they free? Are they affordable? So at that, on that note, I want to hand over to the MC to continue with the rest of the session. Thank you so much. And once again, you can find these insights on our website. Thank you.
Very much for the great research findings and also the insights it raises. Many people are very worried. Many people are anxious. But this has not just started now. Since last year, the people are worried. In the build-up to our first case in March 2020, I used to receive several calls of people who were distressed, people who were asking whether has Corona reached here, people who were wondering what it would mean. Then it came to a time when now people started testing positive. How do you report the signs and symptoms? If you get positive, will you recover? So interesting that we are joined by Dr. Hafsa, who is an assistant commissioner in the Ministry of Health and has been part of the psychosocial support pillar on the incident management team that responds to this COVID-19 pandemic on behalf of the Ministry of Health. So Dr. Hafsa, you'll give us an insight of how it looked like in the early days of the pandemic. We had issues like quarantine. We had issues like isolation. Then from there, we had people in hospital who needed to be taken care of. So how does the Ministry of Health COVID response factor in psychosocial support in hospitals for the patients, for the health workers? Because I can imagine if you are working in a facility and you're losing more than 10 people in a day, what it means for a health worker. Then there are also people at home, because with COVID, there has been limited access to your patient. The ambulance evacuates this patient, takes this patient into, for instance, Morago's COVID treatment unit. You have not seen them for some time. You have to rely on the helpline. I'm glad Morago created the help desk where you can find out how your patient is progressing. But all this, Dr. Hafsa, you will shed more light, and I welcome you to give your remarks, and also in light of the findings that have been presented to us by Marie, what do you read into that, and how can we go forward as we prepare? Because I know there are going to be other waves, depending on how the people behave. We are likely to go into other waves of COVID-19. So how prepared are we as Ministry of Health? Thank you.
Thank you very much, Emmanuel, for the introductions and the moderation. First of all, good morning, Good afternoon and good evening, all our viewers. First of all, I want to appreciate the organizers of this forum. I wanted to thank very specifically to Aweza Nisisi. My first time to hear this. I'm sure it's a Swahili word. I'll be told what it means. But yeah, thank you very much for putting this forum in place for us to, discuss and share our ideas or what we know with the rest of the world. I would like to appreciate the Ministry of Health also for being, very key. And I really want to believe and receive the credit that was given to Uganda for the fight that they've done against COVID. I want to thank the media fraternity all the time for, yearning for information, yearning for data to give out to the people. You're such a great resource that we have in this country. Thank you very much. As I've been introduced, I'm Dr. Hafsa Lukwata. I work with the Ministry of Health. I'm in charge of the Mental Health and Control of Substance Abuse program at the Ministry of Health. This is my third year, I think, as heading it, but I've been in there for the last, I think, 10 years. And I just wanted to give a little bit of highlight on how far we've come as a mental health program. Just to let you know that since 1999, when we had our very first health policy, mental health was actually made part of the minimum healthcare package that had to be received by, everyone. Like it was part of care that was supposed to be provided at all levels, meaning from primary healthcare to the tertiary level. And it had to be integrated. We integrated mental health into general care. We also pride in that as a country, being one of the first that actually tried it out. We know that mental health care has always been institutionalized. People are being treated within, institutions and moreover dungeons, very terrible ones. But as a country, we came out of that and said, let people with mental illness be treated as near to their communities as possible. So since then, we have made some improvements as a country. You've seen the improvements in the infrastructure. Those of you who have moved around the country, I think the mental health units, wherever they are the best buildings on whichever campus you know of. Okay, lately we are being overtaken, but at least since the last 20 years, we've been one of the best. Our buildings have been one of the best. So we have infrastructure in 14 regional referral hospitals, and also we've improved Butabika Hospital. Those of you who have been to Butabika, I think you know that it is a wonderful place. It is so beautiful. It has a very good ambience, but the beauty in there also, the beauty outside is the same as what is inside, because people walk out of that hospital when they are much better. Of course, there's growing international discussion around mental health, and so we are not coming out of nowhere. And in this, of course, as we are developing internationally, we also come along as a country. We've improved in our medication. We have a better variety of medicines currently. We've improved variety. We've improved quality. We have, those that are first generation, second generation. There have been improvements in the medicines in the recent past. We've also improved on our data. In our HMIS, that is the Health Management Information Systems, we have quite a number of indicators we are monitoring as a country. And this is something that is, it is still work in progress because there's a lot that is not coming out in this data. But I think with time, at least we've put the framework under which people can report. So this can be improved as we move along. Mental health in many places, even in the region, I think was not being taken very seriously. I'm not saying it is, but but at least we should give credit where it is due. We are beginning to be felt as a program, as a division. First of all, we were elevated. Initially, was a very small unit within the clinical services department. We are now a division. A division is much bigger, and and I'm here really as an assistant commissioner. So we feel that this is a good elevation. We want to get to department level, actually. We want to have a commissioner, and, we shall have then better human resource, and we shall manage our situation much better when we are many more and when we are working. We come. I think you should remember that we've been handling quite a number of emergencies. For me, the first one that I first responded to was the landslide. I responded to. Yes, there were quite a number of issues that happen when bad things happen. Then from there we went to Ebola. I think there were quite a number of Ebola epidemics that went on. There was one that was around Mugende side, is it Mugisa? And then there was one in Kabale. And then the recent one in Kasese, and now the COVID. So ever since the Bududa landslide, we started having mental health and psychosocial support as part of the response team. At that time, we're not sure of what we had to do, of course, other than just going to counsel. We thought all we had to do was counseling people or putting them in some place, but and giving them maybe food. But we felt that along the way we have learned that providing mental health and psychosocial support is much more than just giving basic needs or putting someone where they need to sleep and that kind of thing. That is very important, but it's a little more. And we have been drumming this to the planners of epidemics or emergencies, that our care as mental health continues a little longer. Many times, like as we've been responding, once the epidemic ends, then that's the end for everyone. Everything stops. But we know that mental health continues much longer than just at the end of an epidemic, because people are still suffering with the losses, people are still suffering with understanding whatever situations they are in, the different situations they get themselves into. So this is something that has not been reached. We have not been supported to offer care long after an epidemic has ended. But I think this one is now teaching us a more bigger lesson, or is making it louder and clearer to people that sure, even after the end of COVID, you have to go through certain situations and issues that may require some support more than what you can cope with. So at the IMT, yes, we are a pillar. Mental health and psychosocial support is a pillar in there. And lately we are working closely with the case management. We are mainly about the case management, but there are certain, we also go into the community, into the home-based care, and then the risk management. We have our tentacles in there as well, because that is where we can easily reach out to the people, So he asked me to tell you about how we managed in the first wave. Yes, the first wave was terrible, by the way. And as far as mental health and psychosocial support was concerned, it was very, very bad for people. We had situations, like I remember a very vivid situation where a mother was locked up in an isolation unit. Actually, I have more than 2 stories to tell you. There was this mother who was taken on from, she was moving she was selling fish near an isolation, a quarantine site. So when these security guys found her near there, I think she was selling her fish. They told her that she had also gotten into contact with the sick people, so she needed to get in. She didn't have a phone, she didn't have anything, she just had her basket of fish and was also put into quarantine. She could not, people at home didn't know where she had gotten lost to, and she didn't have anything. So she kept crying. We found her crying, we found her with her fish. The fish was going to get bad, and And there we are as a psychosocial team having to care for her. I won't tell you what we did, but okay, generally we connected her to her family, and then later she had to go through the 7 days, of course, in isolation, because now she had already entered into quarantine. She had already entered, so she could not easily come out. But it was very sad for her, but at least we made it a little better for her to stay in that place. The other situation that was very funny was a mother who had visited Kabale, I think, and people thought that she had been to Rwanda. And remember that time they said, if you know someone who has just been out of the country, just let them know, get them and they put them into quarantine. This lady had left Kavale for like over a week. It had been quite a while anyway. I don't remember exactly what time, but it had been a while. And so she didn't need this kind of care. She didn't need to go through the quarantine, but the community had already identified her as a Mnyarwanda, so she needed to get into quarantine. So she had gone, she had prepared her breakfast and gone to buy cassava at some place where they make cassava around their place. So she was then nudged and said, this is one of them. She had been in Rwanda. So these guys who are taking on people just caught her, put her in the lorry, and off she was in a very distant, she told me she was staying in some place, but she had been moved into a distant quarantine site. This lady cried. She was on ARVs. She didn't have her ARVs. She had made her tea. She didn't know how her children were going to have her tea. There were all these things that were going on through her mind. It was terrible for her anyway. So we as the mental health and psychosocial team, this is where we came in. We talked with her. We managed to connect her. She was a single woman. The only phone number she knew was of her old husband, her previous husband. Initially, who didn't even want to talk to her, don't tell me anything about that woman. But then we needed to tell him the situation, and this is how, anyway, we got to help her. So there are quite a number of stories that we got to learn during the first wave, and they were all very sad. My story wasn't a sad one because, as I think among the first people who got COVID at the ministry, we had been responding, we had been moving to the points of entry in the different areas, but had gone to Motokula, and we are looking at how people were getting care, especially psychosocial care at the border points. Because remember, at that time, people were really waiting for a very long time as they were coming into the country. They needed to get tested and that kind of thing. And remember, these were foreigners. These were truck drivers, and some of them didn't know the local language. So it was really so terrible for them. Anyway, we needed to go in and see what was happening at the border points. So from there, we'd been there, I think, on Wednesday, and then by Saturday, we had been told that, guys, I think we're having some contamination. We need to check ourselves as a ministry. So on testing, remember, we had to do pre-counseling and pre-test counseling and so on. So as they are very busy counseling people, telling them how they should get ready for their testing, and I'd seen the testing being done, so I was like, yes, it can be uncomfortable. I was telling them generally how things should be. So, of course, then I also had to take my test myself. So this was Saturday, and now on Sunday, it was me who had to go into the isolation because I had tested positive. Oh my God. I took my prayer, I took a breath, just a deep breath anyway, and said, okay, if it is me, let it be. I'm glad I'm the one who has had it and not any other person, because I was preparing people for it. So I was trying to remember what I had to tell, what I was telling my friends to go through. I managed anyway. And now this brings on the other story was how you were picked. Many people had to be picked with an ambulance, making the sirens, remember, the sirens would go on, and then people would get into your home and take you. And there was a lot of resistance for some people. I remember we used to counsel some people for, accepting to come out because they are tested positive, for them to be able to go to the isolation. So now this was me going into isolation. And an ambulance had to come for me. So as luck had it, I got my test I got my results in the night. So they said, yes, we're coming for you. But we shall not come, what I was told, that we shall not come, we will not make the sirens, we will not make the noise, so so the neighbors won't know that they are coming for you. And then they said, okay, we shall again come later when, when many people are resting, and so people won't get to know. And surely they didn't get to know. No one knew apart from my family. But again, telling people, my family members also, the children other than my husband, I had to just tell my husband that I've tested positive. And some of these things can be funny. I'm telling you the story so that you can feel, the psychosocial and what we had to go through as well. So when I went into Mulago, I was taken to Mulago Hospital. I was first put onto the general ward. It wasn't so terrible, but only that the sharing of the toilets and, the bathrooms, and it was a bit not okay, but well, that was what was there, but it was clean. Remember that time Mulago had just been renovated, and it had not been used at all. So it was clean, and it was good. The spaces were good. the blankets and everything were all there. The problem was with the meals. The meals were being served. Of course, the poor were serving were very fearful. They didn't also, were not being protected. They would just bring the, the porridge and the things there. They said, guys, come and pick your things. So everyone would go and pick whatever the package was for them. So later, anyway, being a health worker and everything, they were told, no, I think let's take you to a more private place. So we were taken to the 6th floor, and of course there it was really wonderful. We're like home. I had a sitting room, I had a bathroom of myself and everything. So there are these differences in things, but well, as health workers, yes, I want to appreciate. As health workers, I think that made us feel like, it made me want to continue to help, because then I knew I had support. Like in case I got any other problem, I could still be supported by my government. So those are very important issues and things that we need to think about, the support that we give to people. But also, one thing that I've always told people is the way you react to an event or to a situation will affect you long after, or will affect the outcomes of that event. Meaning, if you quarrel, if you shout, if you make a lot of noise, if you resist, if you refuse to accept certain things, it will affect you negatively. It will hurt you, it will, lead to further damage to your mental health. And, but if you take it like lightly, you accept it, you'll even be able to say some prayers, you'll even be able to call on certain things that make you comfortable, that will comfort you to live through it. So this is a message that I'm passing on to people. This is just the beginning, but I'm passing on this message that please accept a situation when it comes, because when you accept it, then you'll manage it much better than if you refuse and resist and, that kind of thing. So that is very, very important. And I think it is affecting the way we are all, it affects our reactions and our actions as well. So briefly, I think that is how we went through. It has not been very easy, but again, it hasn't also been so terrible, because by the way, people are very willing to help. We got quite a number of people who are willing to provide the psychosocial support. They are there. The mental health practitioners are there, and they're actually willing to offer this support. Thank you.
Thank you, Dr. Hafsa, for your story. I also share almost the same story, because there is that tendency of being in denial. And earlier in the days, there used to be that word asymptomatic. So sometimes they will tell you you're positive, but you don't feel anything. I remember telling my colleagues that I will not allow until I see symptoms. But it hit me hard when I tested positive in October of last year. Because I had just come back from the field. I had been moving, Masaka, then I went to Kanungu. So I really don't know where I had, but I was feeling a headache that hits hard behind the eyes. I was having temperature. So this time round, I took myself for testing. Because at ministry, we used to do mandatory testing, like after a week. But this time, I decided to drive myself to Marago. So when I reached there, they checked my vitals. They were all really symptoms of COVID. So they told me, we are not going to release you. We'll have to take you to the presumptive ward. Yeah, but given that I had seen stories of people recovering at that time, I immediately had to become strong, firm in the mind, knowing that I will get out of here. So when I broke the news to family, of course, it was overwhelming. My wife, for instance, started crying right away. So me, who had tested positive, now was comforting someone who had stayed at home. So I can imagine the situations families are going through. Recently, someone tested positive and underwent treatment for 3 weeks. And when they tested again, they were still positive. this person cried more than even before. At first, she didn't cry, but now she was crying, thinking that now what does this mean? So those are the challenges people go through. So I would need to bring on a professor. Professor, you've seen research findings by Twaweza. You are from the academia. A lot of research has been conducted. What are you seeing from your side regarding these topics? And I know you have been part of the Scientific Advisory Committee. What are some of the issues and how can we overcome some of these challenges based on research? You're welcome, Professor Winston Mwezi, who is Associate Professor, Behavioral Sciences, and is from Ocaro University.
Thank you very much, moderator. And thank you, colleagues, for organizing this event, giving us an opportunity to share what it is that we are dealing with. In this discussion, we are talking about mental health. We are talking about mental health challenges associated with COVID. And I think it's very important to first and foremost get a general understanding of what mental health is all about before we talk about the problems that can or that do affect or do show that somebody has got a mental health problem. First and foremost, how should the person be? Mental health has been defined actually by the World Health Organization. It's a state of well-being in which an individual realizes his or her abilities, can cope with the normal stresses of life, and can work productively, and can be fruitful and is able to make a contribution to his or her community. If you put all those together and an individual fulfills all of them, then you are confident that this person is mentally healthy. Really, when we talk about mental health, we are getting into the realm of emotional, psychological, and social well-being of a person. So there are three perspectives. If you are cooking, those are the three stones: the emotional, the psychological, and the social perspective. And we know that the well-being of a person's mental state affects how the person thinks or feels and even acts. Later on, we will be able to say that a person has got a mental health problem by looking at what the person is doing or what is acting, but also by listening carefully to what the person is telling us in terms of what he's thinking or she's thinking or what he or she is feeling. And mental health as a concept is positive, and all of us need mental health, because when you are mentally healthy, then you are able to determine how to handle stress, how to cope with challenges of day-to-day life, how to relate with other people, and even how to make choices. If you are able to do this in socially acceptable ways without causing any disruption, being in rhythm and synchronized with the rest of the members of the community, then we say you are mentally healthy. Problem comes up when you cannot fulfill what I've just talked about. Then you will be getting into the realm of being mentally unaware. So there are challenges that can arise when somebody is not well mentally, and this could be expressed through emotional reactions, where people will become perhaps distressed. If somebody is distressed, the person will cry even without any cause. People become sad. Certainly, ordinarily, all of us get sad, but sadness we are talking about here is abnormal, it's pathological. You cannot console such a person. So distress, sadness, confusion, unexplainable anger and guilt, anxiety, irritability, fear, all these are indicative of emotional turmoil, which could be associated with so many things. But in this case, we are talking about COVID-19, and certainly we do see what may actually be what we have just talked about. And one of the unhealthy things that are indicative of a mentally disturbed population or group is what we see with, for example, temptation to violate orders or what has been prescribed for purposes of preventing COVID-19. You see high levels of defiance. That is not normal. That certainly, to us in the mental health fraternity, is indicative of a mentally challenged population, people who are extremely distressed by day-to-day challenges of survival, and in spite of what is prescribed to deal with the problem, they go out of the way to try and scavenge for life, for existence. So this defiance, we've heard about vaccine hesitancy in our population. We quite have a number of people who are very hesitant to take the vaccine, and they do not have very good rational reasons why they are not. But it's indicative of somebody of irrationality in thinking, in processing information, and accepting to use this information. So for us, all these are indicative of mental health challenges that are posed or are found within the realm of dealing and managing with COVID-19. Now, there are quite a number of people from research whom we think are more likely to get or to have psychosocial challenges that are rooted in COVID-19, especially the restrictions, the public health restrictions on life that have been put up for purposes of trying to contain and therefore stop the spread of this disease. And some populations are much more at risk of breaking down mentally compared to others. For example, we know that our people who are predisposed to mental illness are much more likely to break down. There are people who ordinarily, Dr. Hafsa has told you, Butabika Hospital was renovated, and there are other mental health units in different regions that were put up. There are patients whom we had already seen in these units. But with the restrictions on life, we are much more likely to see our patients breaking down more than they would ordinarily do. But we also know that the poor and the vulnerable are much more likely to break down, especially those who are household heads and cannot afford to provide for their families because of the restrictions. They are much more likely to break down, and therefore the temptation to defy restrictions are high. We know that adolescents and youth have got severe levels of distress in these COVID times. Young people should be in school. They are not in school. They are at home. Ordinarily, this is the population by age and description of expectation who should be fraternizing and interacting in a school setting. Parents are not teachers. Even by the way, parents who are teachers as professionally cannot manage their children. because there is what a parent can do, but there is what a teacher can do also. So this is a challenge. We have young people in community and getting into all sorts of maladaptive behavior. People will tell you they are seeing telltale signs of increasing teenage pregnancy. They are seeing young girls getting married. You may see drug use increasing because, again, parents are not at home all the time. We leave these children to TV and household helpers, and that's very problematic. But also we have to appreciate that health workers themselves have challenges. This is very distressing. It's a lot in terms of what they are supposed to do, what is expected of them, and certainly their functioning is affected. We know that they do not have everything they would require to function and deliver quality health care, and that can be frustrating because of knowing that you can do something, but you cannot do it because what you need to do it may not be available. So this becomes extremely difficult. We know that COVID-19 is a highly expensive problem in terms of the healthcare system, takes a lot of resources, requires a lot of human resource, and therefore it has disrupted the functioning of the healthcare system. And that's problematic. So even the health workers who would have otherwise managed non-COVID situations find themselves having inadequacies either in supplies or in personnel, and that's problematic. That's what is being seen, and perhaps will be coming out through through publication and research. And I cannot stop this point without speaking about the enforcement officers for the restrictions that we have. These are human beings. At times out in the population, we want to look at these enforcement officers, the soldiers, the police, the LDO, like machines, but they are human. And they have emotions, and they have families, and they have hopes, they have desires, they have aspirations, and they are dealing with a very defiant population. So ultimately, at the end of the day, they themselves can act irrationally and can snap because of having severe mental distress associated with the job they do. We all know that they themselves also contract or can contract COVID-19, many of them have, and then they are dealing with a population that is extremely disobedient and defiant. So this is the population that certainly needs to be helped and needs to deal with the challenges they are dealing with within their ambit, but also that they need to be reached out to through counseling and mental health service. When I don't know whether that answers the question you put to me, but that's what I can say for now.
Thank you very much, Prof. And you have really given us the genesis and also the definition of health and also what is mental health. That is very important, and you have given us the situations that arise when the mental health or mental well-being is lost. And that now will bring me to Elizabeth Ocaro, the president of Uganda Counselling Association. People are in the lockdowns. That means there is restricted movement. People are not earning. Sometimes some husbands might fail to provide basic needs. Relationships might break because if someone is locked up, for instance, in another district, the family is here, a lot of things will arise. So when do all these issues, when these issues arise, what role does a counselor play? And when do you need to see a counselor? Even us who are working, sometimes you find you're overwhelmed by stress. So this has largely affected almost everyone. So when do I make a decision? I say this is no longer an issue I can contain. And how do families cope in these situations where you have to wake up, you're looking at your wife, you're looking at your children, it is day 1 until day 42. So how do we cope?
Thank you very much, Manuel, and thank you very much, our listeners and those who are viewing us on the different platforms. I think since we'll be talking about the role that the counselors play, I think it would be good just to say a little bit about what Uganda Counselling Association does. My name is Elizabeth Ocaro, currently the president of the Counselling Association. I would like to say that the Uganda Counselling Association has been in existence since 2003, and this is our premium body here in Uganda that regulates, or has the mandate to regulate and ensure that professional counseling is embraced in Uganda. So that's the background that I'm coming from. In Uganda, we have over 2,000 registered members. And when I talk about registered members, these would fall in categories of, we have para-counselors, we have counselors, we have affiliate members. Affiliate members are professionals who use counseling as part of their work. We have the healthcare workers, we have social workers, we have the religious leaders. Those come under the umbrella as affiliate members. And then we also have the psychologists who are also members of the association. So that is the diverse membership. So when I talk about over 2,000, those are the people that I'm glad I would be representing here this morning. So just like I said, our role is to see professional counseling embraced, and I'm very grateful to Ministry of Health and the different organizations out there that have come out to recognize the role of counseling and been able to work together with us. And I think the very reason that we are here together shows that there's a lot of work in progress. Yeah, Emmanuel raised a very important question. The lockdown, and I think Professor here brought it out very clearly, what the mental health challenge is, and a lot of that identifies with what Professor was trying to bring out. He brought it out very clearly what the mental health challenge is, and I'll take it on from there. How do you know? Because when we had our discussion before this, I was actually saying that from a personal perspective, the problem that causes this mental health challenge is the fact that a lot of us do not know about mental health. So from that point of view, we realize that it becomes very difficult when somebody is not sensitized to that level. They'll not be keen enough to tell at what point is my mental health on the edge. We know it operates like a continuum. At what point do I know that I am tending into a mental illness? At what point do I know I am losing my ability to cope? At what point do I know that this lockdown is actually having its toll on me? And we know that we are counting down 42 days, but we don't know what's happening even after the 42 days. There were very interesting statistics there about the expressions of fear. And some of those might be around the fact that we don't even know whether after the 42 days we are going to have another 3 months or another 6 months. I mean, we just don't know. So if we went back actually to do another study shortly after the president comes to address us, you might find a very interesting statistic there, because even now we don't know. And it has taken its toll on an individual, it has taken its toll on the communities, it has taken its toll on organizations. You don't know how long you're going to sustain the employees. It's quite diverse. So in observing or trying to be keen on one's mental health, there are telltale signs that someone should be able to figure out if they have basic sensitization on what mental health is. If someone can tell they're losing their ability to cope, they would look out for some daily disruption signs in terms of eating habits. Someone might lose appetite, losing interest in activities that they have always done before, changes in sleeping patterns. I mean, even if you just look back into your own house, you'll find some people wake up by 5 people are awake, but they're in their beds and not doing anything. And it gets to midnight and they'll say, I don't have sleep. Innocently, I don't have sleep. And we'll think, okay, maybe people have a lot more energy. But you might find, you notice a little bit of trend in change of sleeping patterns. We know very well that the pandemic has disrupted our society norms. I was listening to the presidential address, and personally I felt that the psychosocial effect of COVID could have been downplayed. I know the whole restriction, when His Excellency said, well, I think we just go Barry military style, and I'm thinking, put myself in that shoes of that person who has gone through multiple losses, and you have to go through that. You find, and you get into a period of extreme sadness, prolonged period of sadness, because of a lot that is going on. You're locked down, multiple losses, can't go across the district to Barry. We are attending the barriers on Zoom, Facebook, if you're privileged enough to have a relative who can support you to Zoom in, okay? So that prolonged sadness is very, very, very critical. And we know, I'm sure the professor will tell us here that the depressive disorders are getting to soaring. The other time I was saying Uganda is ranking, I think, about the 6th in Africa with depressive disorders. But we know that what gets it into that state is something like a prolonged period of sadness that someone is going through, complicated grief, it just gets into that. So looking at that, try to look out the kind of maybe what experiences someone has gone through. Are they getting into that for a prolonged period of time? Are they being allowed to grieve? And how is it being done? How is it being done? Okay? So those are things stretch someone's ability to cope, but there are also other things like someone just stops minding about themselves. Someone who used to take care of their hair, they just become unkempt. And we know lockdown, the beard is overgrown. You know that those could be some signs of not wanting to care about your normal hygiene. There could be some early signs that you can tell that this is likely to happen. And I must say, this is also why I must say that this has also posed a gap between when someone begins to tell that there are some disruptions in someone's state of being to the time they actually go to seek help. By the time someone is going to seek help, it is almost tending into a mental illness. And that's when now we go to the facility and say, no, this person is not okay. And yet, back at home or back at the community, some of those signs should have started to be noticed, and somebody should have been able to take some action, talk to somebody about it, try to be able to find a way out at that early time before it actually translates into a state of now going into hospitalization. So, I could go on and on and on, but I also want to now go into the emphasis on the role of the counselor. What is the role of the counselor in this? And I will send appreciation to Dr. Hafsa and the Ministry of Health. I think that was a very profound statement that she made about the milestone of integrating mental health into primary health care, which I think that is an excellent step in the right direction. I know at the Uganda Counselling Association, we've tried to keep a very close we are very keen on that because right now as we speak, counselors are not fully integrated into, for example, public service, and it has been it has been and it will continue to be our cry for the government. I think I would say the government, Ministry of Health, to come out and say, can we have the counselors integrated into public service? Why? Because the role of the counselor is very critical when it comes to mental health. So we, like when they say a child has been given, you first take the food you're given, integrate mental health, yes, very good. Now we go and say, let's enjoy this food, but we are coming back to what? To ask for more. They're saying now we follow through to see that public service integrates the counselors in the public service structure, because that will be leaps and bounds for the association, but also for mental health in Uganda. So the counselors, I'd started off by taking you through the cadres that we have, and by default, the cadres that we have then play different roles. I mentioned that we have the cadre, that's the para-counselors, and then affiliate members, people who have attained basic training in counseling, are able to provide help. They'll be able to listen, provide a listening ear, support someone to talk through the issue that they're facing. And where do we find these people? That might be a very key question. Now, because we don't have it fully into the public service structure, you may not go to a health facility and automatically find, for example, at a health center 3 or so. It may not be there. But I know we have some organizations that have provided counselors there in some of the facilities. But I'm going to take you right up to our community structure. We have the family. We have volunteers within the community. If you know of Mothers Union, you know, within the community, we have the local councils in the community. And VHTs, community health workers, who have received basic training in counseling skills. And these people are normally the first contact with this individual back at home. And even the church leaders, or not forget the church leaders. So most of these, I must attest to that because I have engaged with the communities, and I know they have some basic training. They can have a conversation with an individual and be able to support them to listen through. They might not be able to provide high level or specialized care at that level, but at least they'll be able to link this person to say, go to this facility or go to this regional referral, and you'll be able to get help. So we have that basic level at home and in the community. We have people trained. Now we have the counselors. Counselors have attained, say, a diploma in counseling, a bachelor's in counseling. Some of these you can find them in the facilities. And this person has a fair level of training that can make some basic assessment, do a holistic assessment, listen to somebody, and be able to have very good knowledge of the referral system and support this person until they are taken care of by the appropriate service provider. So that is at the counselor level. Now we have the psychologists, and these ones are able to do more specialized care. They can be able to do comprehensive assessments, be able to offer different forms of psychotherapy for the clients, and would find that these can be found actually in some of them. You'll find them linked to regional referrals in private practice. As the association, we have private practitioners who run their own farms and they offer counseling. So I would emphasize that it is very helpful for anyone who wants to source help from a private practitioner. We normally issue licenses. So the person must be a licensed practitioner and a license obtained from Uganda Counselling Association. And that's what would hold us as an association accountable for the service that this person is offering. So in terms of our structure, that is how the different cadres do operate. And basically or generally, the role of a counselor is to help someone to listen out to what someone is going through, make an assessment. We know that some people end up in mental health, may end up being defined as mentally ill, and yet supporting them to talk through might not get them, it can help them alleviate or not reach that state. And I'm sure, Dr. Hafsa, we will not have an overload in Butabika like we are having. We would have some of these conditions managed at the initial stages before they get into mental illness. Yeah, but I know also the counselors work hand in hand with the psychiatrists, to the clinical psychologists, even as they offer care, to be able to follow up and integrate psychotherapy with the medication and treatment that someone is going through. But I think we need to advocate at all our levels that this actually should start within the home or in our communities. And if everyone was keen at that point to do that, to be able to understand what it is, sensitize another person, be on the lookout to arrest these situations beforehand. I'm sure what the scientists are predicting, that so many years from now, it's going to be worse. We will not get there if we started. It's not too late. I'm sure it's not too late, that if we started now, we will be able to alleviate that they seem to be promising will happen. Thank you very much, Emmanuel, and I'm hopeful that a lot of that has been addressed. Thank you.
Thank you very much. Elizabeth Ocaro, the President of Uganda Counselling Association. Those who are joining us on Zoom, on YouTube, we are discussing psychological support, mental health, and home care. And with us, we have had presentations from Marie Nanyanzi, who is the Senior Program Officer, Twaweza. We've had remarks from Dr. Hafsa Rukwata, who is an Assistant Commissioner in the Ministry of Health. We've heard from Professor Wilson Winston Muwezi, who is an Associate Professor, Behavioral Sciences. We expected to be joined by Dr. Jane Irene Nabakoza, who is a pediatrician and public health specialist. I don't know whether she's already online. If she's not, we are glad to have Vincent Mujuni, who is from Strong Minds. And indeed, we have to be with strong minds as we go through this pandemic, as we go through the 42 days of the lockdown. I can tell you already I am getting people who are asking me for help personally because they cannot push with their families. And when people see you, think you have something, but at times we find ourselves in the same situation. Yeah, so we have questions. We have over 70 people who are logged in on Zoom, and they have shared some of their questions. I would like to appreciate Strong Minds for having been available during this pandemic to give counseling, free counseling services. And there is a system you can go through your phone by typing *252*10#. You'll be able to get assistance depending on what challenge you have. So Strong Minds, you'll share with us what has been your experience, what is the volume of people who are seeking for counseling, and what advice do you give to people who have patients who are doing home-based care? Because the ministry, in the middle of this, I think the first wave, we allowed home-based care. This meant that if I tested positive, and I was asymptomatic or mild, I could be managed home. And there also has been a challenge of stigma. You have recovered, but people do not want to know that you have recovered. I remember when I had just come from hospital and done and tested negative, even people who knew, because personally I publicly declared that I had contracted COVID. But you would see someone not comfortable getting close to you. So how do family members who have their relatives undergoing home-based care cope with that situation? How do I cope after treatment? Because we are aware that people are stigmatized. People are segregated at workplaces, among their friends. It takes time, by the way, to be accepted. And this has caused people to keep quiet, even about their symptoms and signs. You might be feeling chest pain, or you might be getting a cough, but you see someone trying as much as possible not to cough. Because if you cough, people might think they will start saying COVID. So how do I accept that this is a disease like any other, and I will get treatment and get healed, like I did? I was in hospital for 10 days. I came out and I'm doing whatever I was doing before. Much as that I realized that the healing process is longer. You will still feel some funny pains in the first months after, but later on you will cope up. And how can people spend their time during the lockdown? We've realized too much use of social media. Is social media good, or it can also contribute towards the imbalance in mental stability? Since it is a source of information, but now it is having a mixture. Credible information, distorted information, fake news. How can I cope? Does doing exercises help? There are questions that have come from Zoom, and I will, after you have made your remarks, I will request Dr. Hafsa and Elizabeth and Professor to also make inputs based on these questions, and I'm going to read them now. To what extent has depression affected families, and who are the main culprits between the males and the females, rural and urban centers? This is coming online. So Kwaweza, who is doing research, these are some of the issues you need to capture in your next research. How is mental well-being handled for medical personnel? It seems they are the most affected. Is there a relationship between fear and one's immunity? Is what they have said mental COVID or psychological COVID, which also is dangerous. Someone says, I know I have COVID before they have even tested. So that is one of the issues. Then there is a comment, mental health and psychosocial support have to be integrated into general care. Another question, what is Ministry of Health doing to strengthen community self-help and social support, given that mental human resources gap at lower levels? Is there a psychosocial support system in place for health workers? So these are some of the questions that are coming from people who are joining us, and we have a number, over 70, that include DHOs. Even Christine Anturo, the Deputy Director, Strong Minds, is there. We have the members of the press. I saw the likes of investigative journalist Irene Abaro. So there are very many people interested in this subject, because in the coming days, we will see more of mental health needs as a result of the impacts of the pandemic. And we are even not certain that it's going to end now. But allow me to welcome Vincent Mujuni from Strong Minds. Later on, in that order, I'll give you an opportunity to respond to these questions. Then we shall have questions from the journalists who are with us here in the room. Thank you. You're welcome.
Thank you. Thank you, moderator, for this opportunity. We thank Twaweza for organizing this space for us to enlighten ourselves, but also the public about the mental health and psychosocial concerns that are coming about as a result of COVID-19. My name is Vincent Mujune. I work for Strong Minds, and Strong Minds particularly has a mandate to improve the mental health of women in Africa, particularly due to the vulnerable nature and the state or positioning of women in the social construct of our culture in Africa. So women are generally more vulnerable to depression in Africa. Our goal as an organization is to treat and improve the livelihoods of the lives of women in Africa, and our target is 2 million women by 2025. And our expectation is that by that time, we will have reached that target and reached out to several women out there with the treatment for depression. We are one of the few organizations that pride itself in treating depression to scale. We have concentrated on that using a WHO-approved approach, which is the interpersonal psychotherapy for groups. And it is through that we are able to deliver the care for persons who are depressed and those who are anxious across the country. We have presence in a couple of districts in Uganda, and our big or main ways of providing care are mainly through the in-person care, which we have been doing from the beginning of Strong Minds work in Uganda in 2013, when we would go into a community, mobilize community members, assess them, and then take them through the counseling process. That has been constrained at the moment, and since last year, when we had restrictions on movement and public gatherings. And so, through our innovation and work at Strong Minds, we came up with a solution that is able to counter this time, which is called teletherapy. The moderator has just invited you to dial *252#. The option you need to take is option 10. It's the free counseling option. And once somebody logs on, they are able to be reached within a scope of 72 hours for help. So those are the modes of care that we have. Back to your question, moderator. Having heard all that we have listened to, we've known about what mental health is and the kind of presentations that we see when we are not mentally well. And we've seen the structures and how the care is provided and the different options in terms of who provides what kind of care. At this point, I would like to concentrate on the part of what it is that we provide as guidance to them that are going through these times, which are quite challenging, COVID times, and how would they go about their mental well-being? How would they deal with issues of stigma as you raised them, and a couple of other things that you alluded to. We must appreciate that as far as mental health problems are concerned, a couple of them, quite a number of factors contribute to our being not well mentally. And most of these usually happen or drive or lead us to a point where we wear out our own capacity, our own coping capabilities, our resilience to be able to stand and cope again and pick up ourselves again. And usually when we get to that point, then that triggers negative coping practices or mechanisms that make it even difficult for us to remain stable. And what we have seen from a strong minds perspective is that the COVID times are not unique to many of the other distressful times, but they have come out, as Twaweza has mentioned, that they have come out and raised a lot of the key parameters that would be the basis for which one would be triggered to either get depressed or even anxious. We've seen that a lot of people in our society have lost loved ones. And the loss of loved ones, the loss of essential property, there are many people who have been working, and this time has drained them to almost zero. Some have loaned out and sold out all they have just to remain coping. The loss of those things that mean and make value for you always leads you in that state where you are vulnerable. We've seen during these times that there have been numerous life changes that have happened. We knew our routine. We wake up early in the morning, go to work, come back. We knew we would have a time to gather in the evening with the friends. We knew we had time to go and gel with the children in a social club or something like that. All these things have been significantly impacted on by the times of COVID-19 pandemic. And because of these adverse changes in life, there is a possibility that these could begin to work as basic triggers for anyone to become vulnerable or susceptible to having a mental health problem. And our concern in this case is we are not just looking at the case of you and I who are adults. We are looking at the case of what's the case of children? What's the case of the adolescent? What's the case of the illiterate woman somewhere? And we are coming from a sociocultural setup where mental health literacy is not a strong part of us. Actually, the stigma is a strong part of us. But the literacy about mental health stands out as a key gap in our society. Most of us think about health from a physical health perspective and less from a mental health perspective. So what does a mother, what does a person in the community whose options of consideration for health has no mental health in it, translate, digest, and interpret what is going on right now? So part of what we provide or what we are looking at as essential or helpful options is that there has been, and this is something that we should be grateful for, that besides other times when we have had a lot of problems and there is limited publicity about them, but we should be grateful that this time round the sectors, the Ministry of Health, the government arms, in fact, sometimes the pandemics and epidemics are always business for Ministry of Health. For this one time, Dr. Hafsa can testify that we have a holistic response where most of the people around private sector are interested in the situation of COVID-19. People are volunteering free airtime to educate public about the mental health situation and the pandemic itself, and these are helpful options. But how do we help the person at household level, the person in the community that is dealing with this problem at hand? I think at household level, it is essential that one, in the situation or in the event that some of the symptoms, like the ones Professor has alluded to, if you feel that any of these identify with you, the first step, or one of the important steps, is to seek care. And the options for care, in this case, the Ministry of Health has provided a helpline. At Strong Minds, we are working in partnership with the Ministry of Health to promote the free counseling option. And this option is available on *252# and you choose option 10. We are currently answering calls in over 7 languages, covering the Karamojo sub-region, covering Acholi sub-region, covering the Western, covering the Central, covering Busoga. So we are trying to balance that, because in the event that you don't understand what you are going through, seeking help is the first thing. But other coping mechanisms that could help us a lot could be the fact that you need to maintain your contact, your social contacts. These are very essential for us in the reason that they help us balance up the equation of fear, for instance, the equation of the connections that we have in the community. At the same time, if we have lost loved ones, can we help people to appreciate how to grieve and grieve completely? Because some people, because of the nature of COVID-19 and the safe and dignified barriers that are organized for it, there is a potential that death, grieving is hurried, and some people remain with a lot of unresolved grief, and that in later times becomes a trigger that could lead them to problems. So how do we help people to grieve well? How do we create opportunities for psychoeducation that they can be able to find information about how they are feeling mentally from as many sources as possible, through radio campaigns, the social media? I think for the social media, we are in an infodemia where too much information is out there, confusing information, sometimes appropriate information. And the best position as a person who is at the center of this, if you're a father, if you're a mother, if you're a caretaker, or if you are just a person, a young person living your life, staying on the side of the positives is important in a time like this. When you feed yourself more with the negative, your anxiety will just come up. The fear will be an inevitable thing. But you have to choose which sources of information are going to be the trusted information sources for me to listen to, for me to interpret anything that relates to this pandemic. And I think in all intents and purposes, social media has done a great job, but it has also, in the same breath, also contributed significantly to the fear in the public space. And therefore, there is need for you to make an independent decision on choosing which source will work for you. And when you do that, it might save you the trouble that comes with a lot of alarming news and a lot of what do they call them? The headlines that come and the breaking news. And the breaking news are really not breaking just in the information, but they're also breaking you. So how do you deal with that at an individual level? That's something that we are supposed to do. Exercising is important. Working out is important. Why? Because it's a useful disruption for you from any other routines. And you recall that Elizabeth said, you lose interest in the things that you had pleasure to do. Imagine in a state like that, when you have lost interest in the things you had pleasure doing. At that point, what does one do? It is important that you still maintain a fair balance of, choosing that one thing that you enjoy to do. And make sure you do it whether the pandemic exists or not, in simple ways, in ways that are within the law, so that you can carry on with life, continue with life. Feed well. Sleep at the right time and have adequate sleep, because times like this require that you recharge your body. And part of how we do it is by having proper rest. And so that could be one of the ways that could help somebody recover or feel better in a time like this, or cope or strengthen their coping mechanisms. We draw a lot of strength and a lot of value in doing good. If you have something extra, do something good in other people's life. Like you said, Emmanuel, you went out and tried, you had many people telling you how they are failing to cope, how they are failing to manage their own resources. Come in if you have and help somebody. The feeling of helping another will do well for you to boost your psychological well-being. And some of those things will play back in your life. I believe that now that children are home, the screen time that children are spending on the TV could be another driver for them to actually be unstable. How do you manage the time that they are on the screen? How do you balance it with time for them to get physical? Go out and run, go out and play football, or go out and do something that disrupts them from being stationary and only on the screen. Because most of the times when that happens, it begins to trigger all the other aspects that we are talking about in this situation. In terms of the advice, I think the last one that I would still talk about in this case is that in the event that you have a loved one or anyone that you know you got in contact with and is COVID-19 positive, it is only good for you not to cast doubt for yourself, not to feel like you are denying it. It is only good for you to accept that actually, because I got in contact, I could be positive for COVID-19, and that should be your drive to go and test and find out whether you are actually COVID-19.